mental health and physical health are what we like to call interdependent. They're not, you can't really separate them. They do have some differences, but they're very much connected, to the point where you really, in health field, are starting to move in this direction that you have to treat them both together. And when you don't treat them both together, you're really losing out on the beneficial impact of the treatment that you're providing, whether that's physical health or mental health. So not only the impact, but the sustainability of that impact gets dramatically shortened if you don't consider those two elements together, because our heads are connected to our bodies and they're all one thing. There's two ways to think about mental health integration. One way is I have a mental health condition that might be then leading to a physical health condition. And then, of course, there's the opposite of that, where you have a physical health condition that's leading to a mental health condition. So when you're talking about the first way with I have a mental health condition, a lot of mental health is at the very base bottom of it an issue of stress. It's more complicated than that, but ultimately it revolves around this issue of biochemical stress reactions in the body. And stress reactions in the body are very healthy, they're very normal. A lot of people have heard of like fight and flight responses, so kind of that idea, but in a much more broader way. We always have these stress responses going on in our body. When you have a mental health challenge, those stress responses do two things. They get more frequent and they become much more pronounced. And what's happening in the body is the body's dumping all these chemicals into the body through different organs that we have. Those chemicals are actually kind of toxic, and they're meant to be toxic because they're meant to spark other reactions in the body. But if you've got those toxic chemicals going on for too long, or for too long of a period of time, you can have a direct effect on the body. So if you have something going on inside of the body, and then you have all these stress reactions happening too frequently, that little tiny thing that might be, maybe I don't have as strong of a kidney as somebody else might have, and then all those stress chemicals drop that into my kidney is not as strong, and I would have never known that, to all of a sudden I have kidney disease. We don't know exactly the prevalence of how often that's happening. What we do have a better sense of is the opposite direction, where we know that people with chronic illnesses, many of them will develop a mental health condition, oftentimes being depression. In the program that we have here at Loma in the Behavioral Health Center, we talk about the whole person wheel. So in that wheel, you have all these different spokes that make up the entire wheel, and you got to have balance across that entire wheel. So sections of that wheel that we talk about are nutrition, physical exercise. We talk about spirituality. We talk about family, and there's different things inside of family that we look at. You got to keep all of these things kind of in mind, and not just going after, okay, you got to change your diet. Well, that's important, but in order for somebody to change their diet in a healthy way and keep that going, all of the other pieces of that wheel have to be working together. Otherwise, we'll change this one thing here, but individuals and families and social networks that we exist in have a tendency to pull us back to where we were before. So you got to figure out, if I'm going to make this change, what other things around this wheel have to change in order to make sure that that continues to be changed 6 months, 12 months out. For adults over the age of 18, about 50% of us have a chronic condition. Of that 50%, half of them will also have a mental health condition. So if you look at it, there's about 25% of adults in the world that have both. They have a chronic mental health condition and a chronic physical health condition. Chronic pain is a chronic condition that exists, and chronic pain oftentimes is directly related to nerves. So back to this issue of stress and stress chemicals in the body. When those stress chemicals are in the body, they can actually agitate and degenerate the nerves quicker. So you can have more pain than what you probably would be experiencing if you weren't under that mental health stress. And that mental health stress can come from many places. That could be depression, anxiety, or anything else. All of those mental health conditions result in higher stress directly from that issue, as well as living with a mental health condition in a social world tends to generate anxiety and stress within the body as well. So you can deal with chronic pain from a physical health side, and we can talk about physical therapy, we can talk about medications, and all those are great, but one thing that we oftentimes leave out is that you can reduce some of that pain by dealing with the stress that's impacting the level and experience of the pain. Better would be to do it together. So you have your physical health side that's treating with whatever that may be that that physician would be prescribing, whether that's physical therapy, occupational therapy, drugs, in addition to having mental health that's reducing the stress. The outcome both for the physical health side and what we call quality of life is significantly improved when you do them together. Quality of life is a big thing when we're talking about chronic illness and mental health. Most of the studies that we have where we look at chronic illness and chronic physical health conditions, our outcome measures are around this construct called health-related quality of life. So how well are you living, given the fact that you have a chronic condition? Some chronic conditions there's no cure for. It's an issue of management and prolonging of good quality life. So we're looking at that kind of measure. If one starts to feel like their quality of life is not as high as they would maybe like it, or think they should, or think that their care team should be achieving, that's usually an indication that some kind of mental health services might be beneficial, because quality of life can stay pretty high with a chronic condition. One can live with chronic conditions in our current day and time and still have a pretty active, fulfilling life.